And just let me know if you see a big purple Sharpen.
We can.
Good. So good morning, everybody. I am Robyn, and this is Tim, and we are the co-founders of Sharpen. Sharpen is a comprehensive one-stop mental health solution that enables communities to improve mental wellness. I've been working for the last 15 years in different communities with public health researchers in order to bring evidence-based, science-driven programs. First, my work started in the K-12 schools and in academia. So the models that I saw in the trenches have been published in peer-reviewed medical journals, and over the course of those research years, ultimately ended up with the technology platform Sharpen. And Tim and I actually met about 25 years ago working in New York City in the entertainment industry. So I'll let Tim tell a little bit about himself since he's here.
So Robyn and I did meet in the theater a long time ago. I was a director, and I moved out of that into the world of documentary film and television. So my last gig was in New York City as the senior political producer for one of the local news stations.
Our team, of course, is helmed by the great Brian Denstedt, who mentioned he's been on our team at least 2 years. We're very grateful to you, Brian, and very grateful for all you've done and continue to do. It's a pretty robust platform that I'll share with you. And so one of the key components is that we bring together multiple researchers and medical professionals. So we have a fairly robust team of over 200 collaborators who've participated in our platform from the medical side. And then we are engaged deeply with TechCXO. One of the co-founders, Kent Elmer, is our CFO, and another person named Greg Swain, who's our medical advisor, who's one of the original founders of the Atom medical technology platform, worked with Brian at MD Live and some other medical technology solutions. So we're very grateful to have just a fantastic team. What I saw working in the trenches for 15 years was that 1 in 3 individuals struggle with mental health disorders. There's an individual level problem, but the problem we are addressing is more systemic. That affects organizations and communities. And so back then, when we weren't actually having the conversation as readily around mental health, we saw that prevalence and lack of connection, those fractured networks that really didn't allow the individual to appropriately connect to a treatment provider, led to that increase in prevalence and risk. So of course, our solution is this one-stop cloud-based platform that enables us to customize different content directly for the end user. So it's a very comprehensive framework that not only connects the end users to peer stories of resilience and overcoming mental health challenges, but to crisis response, telehealth, and to educational content that supports them in between their clinical visits. And I'm going to have Tim share a little bit about the business model and currently how we've sort of gone to market.
I get a slide.
Yay.
Okay. So our business model here, as Robyn mentioned, this is really meant to be a systems-wide solution. So what we do is work with large organizations and service providers to really kind of hone in on what the end user for their particular area would need. So we work with colleges. We've worked with USC Upstate, for example, here in South Carolina for quite some time, building out the college model. One of our main partners is the United Way. With them, we built an app called Sharpen Family, and that solution is really for foster care and for early childhood development. With those partners, we have several ways that we make money. First of all, we have a platform access fee, a license. Generally, that license for an organization like a United Way is about $12,000 a year. They also build content with us, and that's really a main part of our business, video content that is about mental health and resiliency. Generally, they build 5 to 7 modules in the range of $36,000. We also charge a branding fee for the application.
So thus far, our this version of our platform launched almost exactly a year ago, and already we've been able to manage our 26 different clients, brought on some substantial research partners. We have over 35 users, and of those, 3,500 users, and of those 800, we just hit our 800 mark of actual registered users. The sort of secret sauce within our content is the educational modules that have been created and vetted by specialists in mental health. We have over 400 of those with a video and imagery library of over 1,200. In response to COVID, one of the things that we have done is brought our team together to offer a free resource to entrepreneurs and founders to support their mental health during this trying time. That is done in partnership with our lead investors at Venture South and their nonprofit arm, Venture Carolina. So we have the information in the chat box and also up on the screen to download and check out that resource that's available. We also offered a similar resource for college students. So being in a college town where you are, feel free to share that resource as well, which is available right off of our website. Today, I think a couple of our community sort of requests, we're always looking to increase our research partnerships. So if you're involved or affiliated, interested in research, this is a very collaborative platform that can aggregate a lot of researchers. As I mentioned, just sharing the resource or providing feedback on it. And we do have a Series Seed round that's open, led by Venture South. We would love to take whatever questions you guys have, and thank you.
Awesome. Thank you, Robyn. Thank you, Tim. Appreciate you guys being here and walking us through that. So